These drugs don't only improve the sperm count, it also improves the motility. That's how fast the sperm moves, and also improves the shape of the sperm. In today's video, I'm going to be talking about how to get pregnant with low sperm count. Yes, it's actually possible. And if you want to know more about this, watch this video till the end. And if you're new to my channel, I'm Dr. Amarachi Ijoma. I am a fertility physician, and my channel focuses on everything in fertility and women's health. So if you want more content like this, subscribe to my channel, like this video, and don't forget to leave a comment below. Low sperm count simply means fewer sperm cells than normal. And this means that when you have sex, when you ejaculate, there is less than 20 million sperm cells per milliliter of that ejaculation. Some experts will say it is less than 15 million sperm cells per milliliter of that ejaculation. Then you can say that a man has low sperm count. To know the amount of sperm cells that you have, you can check by doing a test called semen analysis. Semen analysis is usually done with the sperm sample, with a semen sample apparently. And the way you get the semen is when you masturbate. So you masturbate and give the semen to the laboratory, and then they check for how much sperm cells you have. Now, this test doesn't only show the amount of sperm cells you have, it also shows how fast your sperm cells are and the shape of your sperm cell. When you do a semen analysis and you find out that your sperm count is less than 20 million or less than 15 million sperm cells, then there are several things that you can do to improve the sperm count. But then you have to know the cause of the low sperm count. And for you to know this, you will need to see a specialist called a urologist. These are specialist doctors that deal with male reproductive organs. So before I talk about how to improve the low sperm count, you have to understand some of the causes of low sperm count. So I'm just going to generalize them. One is genetic abnormality. It could be that the cause is in your DNA. You just find out that you're producing low sperm counts. Another one is hormonal imbalance, where you're having abnormal levels of hormones in your body. So you have a particular hormone that is higher than it's supposed to be or lower than it's supposed to be. This could affect the production of sperm cells. When it is as a result of hormonal imbalance, seeing an endocrinologist can actually help. Also, obstruction. Obstruction is like a blockage. Just like the English meaning of obstruction, there is a blockage, so the sperm that is being produced cannot pass and get all the way to the testes. Sometimes it could be because the veins in the testicles are dilated. This can actually affect sperm production, and it is called varicocele. This occurs in 10 to 15% of men. It can cause low sperm count, affect the movement of the sperm, affect the shape of the sperm cell. But once it's treated, it can improve fertility like this. I just want to put this out there that low sperm count will not affect your sex performance or skills. It can only affect fertility. If the problem is with your DNA, your doctor might want to ask for an additional test called DNA fragmentation index. This test can indicate difficulty with the sperm cell penetrating the egg. And also, if maybe you've had a history of miscarriage of unknown cause or an unexplainable cause, then DNA fragmentation index can also show that maybe the cause is from the man. So if you have low sperm count, I'm going to be listing out ways you can improve your sperm count in order to make a baby. One is a healthy diet. I can't stress this enough. This is what I tell my patients all of the time. Anything you put in your mouth that is good for your body, that is good for your entire health, is good for your sperm. So make sure your diet is rich in vegetables, fresh vegetables and fruits. Make sure your diet is rich in nuts, is rich in protein. These foods have been studied and have been shown to help the sperm cell, to help both production of sperm cells and sperm counts. Exercise. Do regular exercise. If you can do it daily, like every day, at least 30 minutes every day, then good for you. Because obesity has been shown to reduce testosterone in a man. Testosterone is a male hormone that is responsible in sperm production. Avoid exposure to heat. After the pandemic, a lot of us have been working from home, so we are using our laptops every day. Avoid putting that laptop on your lap. It's the heat from the laptop can affect the production of sperm, can affect the sperm cells in the testes. Avoid wearing tight boxers, nylon boxers. Avoid anything that can expose your testes to heat. Reduce alcohol intake. If you're someone that you can't go a day without taking 5 bottles of alcohol, then you should consider reducing your alcohol intake to at least a bottle per day, or maybe 2 bottles, but don't go above 2 bottles per day. If possible, if you can stop, then fine, but if you can't, reducing it has been shown to help. I'm saying this because alcohol can affect sperm production. Avoid smoking tobacco and marijuana. I can't stress this enough. These guys can affect sperm production. Reduce stress and sleep at least 6 hours every day. This is because there's a part of our brain that controls the sperm production, and this part of the brain needs to recharge. So when you sleep at least 6 hours, at least 8 hours every day, then you are recharging this part of the brain and it's going to work efficiently. If you're on any medication for maybe any other diagnosis, maybe you're seeing a different type of doctor, maybe a heart specialist or a kidney specialist, or you're just on any medications and you have been diagnosed with low sperm count, bring all those medications, take it to your next visit to the fertility physician. Let this person know, let this doctor know, these are the medications I am currently on. Can any of these drugs affect my sperm count? I'm saying this because if you're hypertensive and you're on amlodipine or nifedipine, those drugs have been shown to affect the potential of a sperm to fertilize an egg. Also, there are some men on testosterone drug. They are thinking that, oh, this is going to help me produce more sperm. Instead, it is not. It actually reduces sperm count. It actually causes infertility. Like, it's one of the complications. Infertility is one of the complications of taking testosterone. So all of these medications you're on, make sure you show your doctor so they can know which one can possibly be affecting your sperm count. And the good thing about talking about this with your doctor is that sometimes when you stop these medications, it reverses the effect of what it has done. Your sperm count becomes normal again. Most times, before a patient even comes to the hospital, they are already taking prenatal vitamins. Yes, it's not only women that take prenatal vitamins. There are male prenatal vitamins as well. There are some popular brands like, I think, Fertilovite, Fertil Aid, Fertilmen. There are a lot of them, but these are like the common ones that I know a lot of my patients use. Even though some of them don't take it the way they are supposed to take it, they might just take it for like a month or like a week. Meanwhile, you're supposed to take it for at least 3 months. Well, 2.5 to 3 months. This is because the body takes about 2.5 to 3 months to produce a brand new sperm. And I must also put out there that the fact that you're taking this medication does not mean that it will improve your sperm count. Yes, it has been said to improve the sperm count of some men when they take it, but not everybody that takes it will get that effect. That is another reason why you need to find out the cause of your low sperm count. These drugs don't only improve the sperm count, it also improves the motility. That's how fast the sperm moves, and also improves the shape of the sperm. If you're currently taking any supplement, any prenatal vitamin that is not any of the ones I've mentioned, then just check the bottle of the ones you're taking. There are some contents you should look out for when you're shopping for a male prenatal vitamin, and these are folic acid, zinc, L-carnitine, black cumin. You can look out for these components on the bottle of the supplements that you're taking. It doesn't have to have all of these components, but it should have at least a combination of some of these components. So the good thing about seeing a urologist, a fertility specialist, and an endocrinologist is that there are several causes of low sperm count, and there are several tests that you will need to do to determine where the cause of the low sperm count is from. So many times when we find the cause, we'll know the perfect solution for you, because the solution for Mr. A would be different from the solution for Mr. B. It all depends on the causes of the low sperm counts. If you've tried all of these methods that I've spoken about and you're still finding it difficult to make a baby, then you should try IVF, in vitro fertilization. In vitro fertilization is a technology which we use to assist couples that are finding it difficult to make a baby. So in IVF, even if you have 500 sperm cells, all we need to do is take one and then we can inject it into the egg. This is another process called ICSI. I've spoken a lot about this in my previous videos on IVF. To know more about IVF, you can click on the link up here. So no matter how low your sperm count is, a procedure called ICSI can be done with IVF. ICSI simply means taking a sperm cell, just one sperm cell, and injecting it into an egg to fertilize that egg. So as long as the sperm cell is good, of which we'll pick only the best sperm cell to inject into the egg, and then fertilization will occur, and then we transfer the resulting embryo back into the woman. If you found this video informative, if you love this video, don't forget to click that red subscribe button below, like this video, and if you have questions, leave a comment below. Also, if you want YouTube to notify you whenever I post a video, click on the notification bell below. Don't forget to subscribe, guys. See you next week.